Good morning. I thought today I will try to give some insights on the problems faced by college students, especially the professional college students. My experience with students tells me that almost 20 to 30% of the students during normal times they suffer from stress related problems. And especially in a situation like this, the COVID era, the era of lockdown, as a psychiatrist, I expect that there are lots of problems the students are facing. Basically, there may be students who are stuck in hostels. There may be students who have found themselves in a situation where they are suddenly isolated. And basically, I'm trying to concentrate on problems of these students. What I have noticed is the most important problem these students face is anxiety. Some people come to know their heartbeats. Some of them feel restless. They can't sit in one place. They feel tense. They feel something untoward may happen to them. Many of them may fear corona because this is the inputs they are getting from media, social media. And some of them who are at home may have genuine concentration problems. Some of them will have queries on academics. And of course, this uncertainty has led to a lot of new things. Some have worries, especially those in the final year would be worried about their job problems, how is the job market, and of course, added to this is the change of routine, stress of academics. So, these are the things which are making our children, the college students, really stressed. So, first thing is what are the different types of stress related problems that can occur. The first one is what is called as anxiety, especially generalized anxiety disorder, where they fear that something untoward may happen to them. They get headaches, they get backaches, they feel always on the edge, they come to know their heartbeat, they feel anxious, they feel jittery. Then there are people who develop depression. Depression is a state where they tend to think negatively of themselves, negatively of future, negatively of the past. They tend to have decreased sleep, they start feeling hopeless, worthless, many of them feel suicidal. So the third one is the substance abuse related withdrawal, because now what has happened is because of the tight enforcement by the government, many of them may not be getting alcohol. Some of them may be addicted to alcohol, ganja. So now when they are not getting this, it is natural that they develop some withdrawal symptoms. In fact, these withdrawal symptoms are similar to anxiety and depression. Some of them come to have tremors, some of them come to know their heartbeats, some of them have restless nights, they get lot of bad dreams, they cannot sleep properly, and in worst cases, some of them even have fits. And many of them even become confused, they start hallucinating, they start seeing things when nothing is there, they start hearing voices when nobody is speaking. So these are the common psychological issues a student can face, especially as I told you earlier, the hostel students, the students who are in isolation, and students who have already been having psychiatric problems. These are the people who are going to have problems. So, my earnest request is, if you are facing any such problems, first thing is you please contact your college mentors or try to get hold of a psychiatrist. Nowadays, with the Government of India guidelines, psychiatrists are available for teleconsultation. So, this is the first thing you should do. Second thing is, please limit the use of social media. Please limit the use of even seeing these TV channels. Try to reduce them, because what is happening is the information overload that is occurring, and that too misinformation, false news that is spreading creates lot of anxiety. So try to avoid this. So these are some simple ways by which you can face this current scenario. At the same time, I would like to tell you some self-care tips. The first thing is try to improve your immune system. Sleep for at least 8 hours, because nowadays there is not much of educational schedule. So make it a point, try to sleep 1 hour during the daytime and 6 to 7 hours at night. So this is something you should remember. Then try to have a exercise schedule. Say for 1 hour, you can even try something like having some workouts or Zumba, something like this, or even dancing. And after this, probably another thing you should try to do is find a way to have focus, because what happens is many of us become unmotivated. We do not know when are the exams going to be. We do not know, like yesterday UGC has given a circular which says the academic season will begin from September. So you are totally unfocused, unmotivated, and you tend to procrastinate. Let me do it later. There is a lot of time, but please understand, this is a golden opportunity for you. What I request you is, please establish a routine. See that you are in a different place where you work. Don't work on the bed. Don't work as you sleep. No, that what happens is that will create a sort of sleepiness. So what I would suggest is, have a different place where you sit and work. Create a workplace and try to concentrate on your work. Then the next thing is, try to join with friends. Maybe you can have a group. Of course, there is this norms of social distancing. What I mean is, have a virtual group. You can set some tasks and start reading on that. Set some targets. And many of you, those who are in the profession like engineering, medical, I would suggest try to learn new skills. There are a lot of new courses available, new advancements. Say for an engineering student, things like the updates on Java, updates on any subject you would like to have. Then apart from this, the next thing is, many of you are becoming lonely because of this social distancing, because of this bar on going outside, because of this lockdown. So what I would like to tell you is, use the social media. See, there are a lot of things in social media which are good, like the Google Hangout, the Zoom app. This can be used to connect with others. You can always listen to your friends and always talk to them, and even the group calls which you can make on WhatsApp. So try to have half an hour to 1 hour sessions like this with your friends. So this will help you. The next thing is, what I have been noticing is, many students are finding it difficult to share their problems. Lot of problems do occur. Life doesn't stop with corona. Life doesn't have a pause. Lot of emotional disappointments. Recently I had a student who was broken over his romantic relationship. So what happens is, you don't get to discuss with others. What is happening is, there is another student who had to give his dissertation, and now there is a postponement. He never knows when is the next time when he has to give his dissertation. So what happens is, it goes on postponing. This uncertainty creates stress. So one of the ways you can manage disappointments is, try to talk to people. Try to call them on phone. A problem shared is problem halved. A problem kept in mind is problem doubled. Please understand this. Try to share your problems with somebody who is reliable, somebody who will not talk about this to others. Try to share your problems. So, even in fact, I had a student who lost his mother recently, and he has nobody to, he couldn't even go to her funeral. So this has made him very depressed. So this is the time where you need to reach out to others, your friends, talk to them, and if not physically, at least you can talk to them over phone, talk to them over WhatsApp. So many avenues are there. The next thing is, many of you are fearful of this disease. There is a lot of information, misinformation. Please understand, this disease has no vaccine so far. This disease has no medicine. The only thing we can do is, certain things which can be easily followed by us is, one is repeated hand washing using soap and water. Sanitizer, if we are in a locality where we are doing some work, sanitizers are meant only for police, doctors, bank employees who are at bank, I would recommend students you should use more of soap and water. So repeated hand wash, social distancing. Social distancing means at least a distance of 1 meter. Please understand why they say, why they stress on this. See, there is no other cure for this disease. We should always limit our interactions. We should also see that when we talk to each other, there is a distance of 1 meter, because this disease spreads through droplets. As I am speaking, some droplets can come out of my mouth. Research says that these droplets will not go beyond 1 meter. This is the reason why they are telling you to maintain social distancing. So please understand, you have to focus on these things and stay away from going outside. Please don't go outside. Be in your room, because these are the only ways by which we can protect ourselves. And please understand, I am always reminded of the Alcoholic Anonymous prayer, which says, "Grant me serenity to accept things I cannot change, courage to change the things which I can, and the wisdom to differentiate between the two." See, this corona is beyond our control. What is under our control is our reaction to it. What is happening is many of them are getting stressed because they develop cough or they develop headache. They suddenly Google. They then say, okay, am I having symptoms of corona? They start worrying about it. So my earnest request is, please understand, corona is beyond our control, but Googling about it, unnecessarily worrying about it, repeatedly seeing about it, this is under our control. Please understand, how you think affects how you feel, and how you feel affects how you behave. So mind your thoughts. Please don't give any scope for negative thoughts. Please do not worry about negative thoughts. Please try to reduce negative thoughts. Don't go on thinking about this disease. Don't go on browsing how many cases in Bangalore, how many cases in Udupi. There is no point with this. And try to stay in the present moment. Please understand, these bad times also will pass. Try to only think about the present moment. And whenever you are feeling stressed, one thing that can help you is deep breathing. Take a deep breath, then leave it. See, basically what happens is, this is what we call as abdominal breathing. When you breathe like this, you feel a bit relaxed. And please understand, all of us are in the same boat. We are in difficulties. The entire country is facing a new phase. In fact, this post-corona is going to be a very different phase in our life. Please understand this. But many things are going to stay. For the next, if you look at what is happening around us, probably the next 1 year, we need to have a mask. We need to maintain social distance. We need to improve our hygiene. We need to wash our hands repeatedly. These things are going to stay with us. So my earnest request is, don't fear corona. Corona se daro mat. Please understand this. Only way we can face this is scientifically. What we need to understand is, there is no vaccine. It will take at least 1.5 to 2 years. There is no medicine. Only way is improve our immunity, so that even if we get corona, our body will be able to face it. So concentrate on reducing your stress. Try to involve your social support systems and relax. Thank you.